Hi guys, it's Dr. James from Geelong West Vet Clinic, and today I've got my little assistant Maple here. She's one of my daughters, but I'm talking about what to expect when your female dog comes home after they've been desexed or neutered. So typically here at Geelong West Vet Clinic you'll find a few things, which is all part of our standard level of care. You might find the patients that have a little clipped area on their front legs, and that's typically where they will have had their intravenous catheter placed to allow us to give them their anaesthetic agent to go to sleep. Also allows us to give them stuff like methadone, so a strong pain relief, intravenous fluids for the purpose of their surgery to aid their recovery and their blood pressure. It also allows us to have access should there be anything unexpected under the surgery. The other thing you might find is they'll have a little area of hair clipped on the underside of their neck, and typically that's where we're taking their pre-anaesthetic blood test. And what we're looking for in a pre-anaesthetic blood test is to make sure their liver function, their kidney function, all those other little parameters are quite normal. And we do that because there are some circumstances where we may modify their surgeries or their protocols based on what we find at the blood tests. The other thing you'll find for the female dogs, it is an intra-abdominal surgery, so it can be a bit tender and sore. So they will be surgically clipped up in this area. They'll have a little incision made on their tummy. The incision's allowing us to remove their ovaries and their uterus, so it's a full ovarian hysterectomy. What you'll tend to find is internally they'll have some stitches. Externally you'll only see some skin stitches, but there's also some fat and there's some muscle stitches underneath. So from your side of things to get concerned about if your little female dog is having issues, if you notice any excessive blood, any swelling, any discharge, definitely don't hesitate to give us a call. What you might be seeing is the dogs have started to lick and chew at their wound. But definitely it's not normal, if that makes sense. So again, have a look when the pets arrive home, because it might give you an indication of what normal is for your pet after surgery, or a bit of a reference point at least. We will typically send them home with the old e-collar or bucket or cone of shame, whatever you'd like to call it. And that's designed to stop them licking at this tummy area here, or some dogs do lick on that front leg where the catheter was placed as well. It's not for everybody, not every dog needs it, and it is designed to be long enough that little noses can't get around and stick their tongue out to get it. So it does look a bit impractical on some dogs, we realise that. But guys, then the other thing too is we send them home with pain relief. They are given some pain relief during the surgery, so the after surgery. We often send them home with perhaps some liquid pain relief or some tablets and so forth, and that's to give them some relief for the next couple of days when they go home, which again, if they've got their bucket on, it makes their wounds not as bad as well. Because they've been anaesthetised, you might find they're a bit quieter for 24 hours, and that's typically quite normal. And again, we recommend giving them some bland food after surgery, such as Hill's chicken and rice, or even chicken and pasta, just something a little bit bland because they may have a bit of an upset tummy. The other thing to do is, because it is an anaesthetic they've been having during the day, we often recommend keeping them indoors and keeping them warm, at least that first night after surgery, because some patients do find it harder to regulate their temperature after the surgery. But otherwise, guys, that's effectively the day of the surgery, and you shouldn't have any major issues. We're obviously here if you need us. We typically see you back in 72 hours or 3 days to see one of the nurses, and they would check the wound to make sure there's no signs of redness, soreness, or any discharge or anything like that. And if they're worried, obviously the vet's on hand to give you advice or see them as needed. We then typically see them back at the 10 to 14 day mark to take those stitches out, and that's effectively it from their recovery. They can generally go out to swim or to wash or anything like that afterwards once the wound's nicely healed. And again, if you're worried, don't hesitate to call, that's what we're here for. But guys, otherwise I hope that's clarified some of the things that occur after your pet's spayed, and if you've got any worries, give us a call, that's what we're here for. So bye Maple, see you soon guys, take care.